Sure.
Welcome everyone for the uh, so fantastic webinar by Dr. Garima Poddar. I'm very happy that she is back again, and this is second time we are meeting here. Obviously, we have met all over India for various conferences and all. I have attended her lectures. Everything is fantastic whenever anyone learns from her on Facebook or social media or any lecture or her courses. So welcome you all, everyone. You have got the opportunity to learn from her. Welcome to ADC. ADC is Academy of Dental Careers Inclusive. We are conducting webinars since 2017, and this is now 168. Already we have completed the 169 and 170. So let's welcome Dr. Garima Poddar, ma'am. I will introduce in short with a brief biography. Dr. Garima Poddar completed her graduation from Bharati Vidyapit Dental College and Hospital, Pune, in India in 2005. She has received fellowship from the prestigious International College of Dentists. She is also a fellow of Fire Fortune Academy. She practices microscope enhanced dentistry routinely at her center. She has a clinical experience of vast 17 years. At present, she is a senior consultant in the dental department of Shanti Memorial Super Speciality Hospital, Cuttack, Odisha, and is a faculty at Universitat John UIJI, Spain, for Diploma in Endodontics program, which is internationally recognized. She is certified gold member for Style Italiano Endodontics, which we all know because we keep on seeing her cases, documentation, which are very beautiful cases and beautifully documented. We should learn that from her and do it in our practice also. She is a key opinion leader for many dental and endodontic companies. She was the winner of FAMDent Outstanding Dentist of the Year Award for 2023-2021 and also highly commended Outstanding Dentist in 2022. She also won FAMDent Special Jury Award in category of Outstanding Dentist of the Year in 2019. She also won third prize in Endocase contest of the Indian Endodontic Society in 2024, which is to be mentioned here. That's why she's mentioning. Apart from this, she has won so many contests, which is we are not mentioning because of short of time. She has delivered keynote lectures at many reputed national and international platforms. She has presented papers in various conferences at state, national, and international level, and also contributed chapters to books. Number one, Clinical Atlas of Retreatment in Endodontics. Number two, Bioceramics in Endodontics. And she has keen interest in sharing her endodontic experiences with budding dentists. Her favorite topics include modern root canal treatment, rubber dam isolation techniques, and magnification. Because obviously she is using microscope since long time, and we all are fan for the beautiful documentation under microscope, and we will looking forward to it. So let's start the webinar. Over to you, ma'am. Welcome.
Good afternoon, everyone, and thank you so much, Dr. Sudhir, for extending this invitation. It is always a delight to be with your ADC and do some knowledge sharing. And special thanks to all those colleagues who are here for this webinar on a Sunday afternoon, because I can understand the zeal which you must be having to learn. That is why you're there on the Zoom platform today. Now, without further ado, I would like to talk about this topic, which is mastering irrigation for predictable and superior endodontic outcomes. Now, you know what? Why I chose this topic is because sometimes, when we talk about rotary endodontics or modern endodontics, we are talking more about how to shape the canals, how to just, we look at the x rays and we want beautiful looking radiographs. But Having said that, is that sufficient or enough? Is just shaping and a good obturation the key for predictable endodontic outcome? The answer is that we definitely need something more than that. And one of the very important pillar for a successful and predictable root canal treatment is irrigation. So when we have disinfected and cleaned the canals and the canal spaces really well, that is where we can ensure that, the chances of having a good longevity of that particular tooth would be very, very high. Because it is usually what it is said is that what you take out of a root canal may be more important than what you put in it. So, shaping is one part, that is the mechanical debridement or, going till the working length. And then we want a good obturation. But if we clean well, if we remove the infection, the tissue debris, the pulp tags, the microbes from the root canal system, then only we would be able to obturate properly. And then only there is a big chance that the tooth would survive for many years. Someone's microphone is on. I would request them to mute themselves, please. Now, if you so this is something which I'm saying not out of just it is not a random thought, but it is a properly documented thought. So if you read standard textbooks or peer-reviewed journals, articles, etc., every article suggests the same thing, which says that elimination or significant reduction of irritants is very, very important for a successful endodontic outcome. And the main objective always is that we are eliminating the microbes from the root canal system, and then we do a three-dimensional obturation, or we aim at a three-dimensional obturation because we want to prevent recontamination of those root canal spaces in future. So one has to understand that, if there is inadequate obturation, then that is not the only cause which could lead to an endodontic failure. In the first place, if I did not sterile or disinfect the canal properly, that definitely invites trouble. So, irrigation plays a very important role in elimination of microbes, removal of smear layer, flushing off the dentinal debris and shavings during irrigation, also acts in lubrication, which would help and facilitate instrumentation. So it has multifold benefits. Now, let us understand the root canal spaces first. See, I mentioned the term root canal spaces. I did not say root canals. So, which is backed by various endodontists and researchers since time I can think about. So, this is an image from England back, and you can see over here they took so many teeth and they did a lot of studies, and they found out that teeth are always having a different ramification. It is just not about single canals or main canals, but there could be lateral, loop, delta, anastomo, etc, etc, etc. So if we look at the recent times, there are so many micro CT images, and researchers like Dr. Marco Versiani and all, they have actually shown so many evidence-based data to us that yes, the teeth is not only having it is not having root canals, but it is having a root canal system, which might be having a very intricate anatomy with different ramifications and anatomy. So let us correlate what I just said with some of the clinical cases. Now look at this particular molar. Over here you would see in the distal canal, you can see there are one main canal and two lateral canals. So there are three portals of exit. Similarly, in this root, there is a mid-root lateral. So the point is that if I want to prevent recontamination of a tooth, I definitely should attempt to seal all the portals of exit. Now, how do I seal those portals of exit if the canals are already clogged by debris and tissue tags, etc.? If I've cleaned properly, then only my obturating material, my cones, and my sealer would flow in those spaces and would be able to give a good hermetic seal. Similarly, you see this. This is a C-shaped canal. Now, in C-shaped canal, we know that the Hertwig's epithelial root sheet did not fuse at the correct point during the developmental stage. Now, as a result of which, we have a lot of spaces in between two canals where a lot of pulp tissue, microbes, debris would be harboring. Now, how do I clean those spaces? Because my file would not be touching each and every area of that particular space. So, for that also, I have to depend upon good irrigation protocol. Now, have a look over here. Let us now forget for the time being about root canal spaces. Now, let's only talk about root canal. Now, even if I talk about a root canal, let me take a cross section of a root. Now, when I take a cross section of a root, the above image which you see on the screen is a cross section of a root. Now, inside the root canal, the red area which you see, that is the area which would be touched by our file. So when I'm doing shaping, my file would touch only a limited area. Well, the green area is the area where my file is not touching. So all those who feel that, oh, mechanical debridement and shaping using different techniques, let's say I'm doing a circumferential filing or I'm doing a watch winding motion or whatever, I would be able to touch each and every wall. No, it does not happen that way. So look at the below, like the lower image. Now, whichever angle which I might try and attempt, my green area is where the file is not touching. So what happens is, around there is a percentage of area inside the main canal also which would always remain untouched with our files. Because why so? Because my canals inside, they are never a perfect round. They could be roundish, they could be oval, elliptical, flat, ribbon shape, but our files are round, right? So whatever strokes we are giving and whichever motion we try to attempt, there is some area inside the main canal also which may remain untouched. So how do we clean those areas? We clean those areas with the help of irrigation. No, no, it is showing me that it is being recorded.
No, ma'am, it was not. It was stopped at 11 minutes and we will start at the end when we are going to conclude.
Okay, okay.
I'll stop it again.
Only one seat left. We have only one seat left for this particular workshop, and we are covering a lot of good topics, lectures, demos, hands-on. If you're interested, you could DM me later on. And I would like to close by saying something which I read and it really, stuck with me. That is, I'm still learning. This was Michelangelo who said at the age of 87. So, we if we have the mentality of being a learner for life and you keep on learning something new every day in your profession or in life otherwise, that is how we grow each and every time. So thank you so much.
Wonderful, wonderful presentation, ma'am. 5 point summary is there. What we take out of root canal may be more important than what we put it in. File does not touch each area of the canal and tissue. Clean the root canal system thoroughly. Good irrigation success can increase longevity of root canal success. IIRI irrigation protocol should be followed. You need higher skills, patience, practice, experience, learning. Just like ma'am said, now also she is learning, being a mentor also, and higher technology and equipments for superior root canal treatment success if you want in your practice. So this is what we learned today. You can go through again and again, and as well as you want to uh, explore more and continue learning, you can definitely register for the course. Not this course, in future, if you are having time, in future also you can contact directly to Dr. Garima ma'am. And we have that group now that is exclusively for endodontic thing. Uh, Ma'am will tell when we will stop online support in that group. So consent of the mentor is also important. So as far as she is free and she will be supporting us online, we will keep that group alive. So thank you, ma'am. Thank you for the wonderful presentation. And you
Thank you
all
so
welcome.
much. Yeah,
Yeah, yeah.
thank you so much, Dr. Sudhir. You have wonderfully concised the minutes, like, the main point, the salient points which I mentioned. Really good takeaway points. I think small points, sometimes we feel that I need a high funda point, for my practice, but actually, in the basics lies success. And the second thing is that about the group, yes, I'm more than happy to be contributing to the group. If you are practicing and you find a particular case you would like to discuss with me or with anyone in that group, feel free to keep on sharing on that group. Whenever I would find time, I would definitely respond on the group. So thank you
That's
so much.
so nice of you and great. We are all are grateful for that. You all can ask questions here in chat box. Yeah, one question is there, ma'am, from Dr. Kaushal Singh. Is commercially available hypo equally effective or any specific company hypo that you recommend?
Okay. See, the problem with the commercially, what you're trying to say is, like, let's say those industrial hypochlorides which we are there, or a Clorox which is there on the counter in a supermarket. Now, the only problem with those is, like, the concentration cannot be gauged at time and could be very high. So, there was a time when with hypochlorite, couple of years back, people started using 6, 7, 8% hypo also. But then now studies are again recommending that we have to strike a balance, and a bit of lower, like, not going above 5 is a better idea. So what I would suggest is, for me, the brand does not matter too much. But having said that, companies like Septodon, Circamed, etc., these are like, giving you hypochlorite, which are very, very safe to be used intraorally and having the efficacy. Now, one brand I mentioned is having a 3% concentration. The other one is having a 5.25% concentration. Both are equally effective. With both, you would be able to achieve the same action. The only issue is that when it comes to hypochlorite, the concentration and the volume also play a very important role. So if you're using higher volume, more and more, you're replenishing the canal with more hypochlorite each time, then it will have more effect. And let's say I have diluted my hypochlorite with with the distilled water or saline a lot, then in that case, I will have to dedicate 5 or 10 minutes extra for that action to happen. So let's say I achieve, complete disinfection in 15 minutes with 5%. I would need 20 to 25 minutes with 3%. So that is the thing. But yes, I would say that do not use a 6%, 7%, or 8% hypochlorite. That is too much to handle for your tissues or periapical tissues, etc. I think there is one more question.
One more question. Yeah.
Yeah, ma'am, I had a case in which MB canal is weeping. Okay. I can give Metapex dressing, but still MB canal is weeping. I can do that case, give triple antibiotic paste during, yeah. So, Dr. Vaishali, was only mesiobuccal canal weeping, or was like others were also having ooze from the canal?
Ma'am, only MB canal is weeping.
Okay. So first and foremost, one reason why MB was, like, sometimes what happens is during instrumentation, we go periapically. And when we go periapically, that could be the reason why one canal is, having suppuration or any ooze and it is not dry. So I would recommend that number one, always try to reassess your working length for that canal. And yes, you can give an triple antibiotic paste for those reasons, or you could also give a calcium hydroxide dressing in that canal. And maybe like I have seen in my cases, whenever I give calcium hydroxide dressing, sooner during the next appointment, within a week, you would see that the ooze has stopped and you would get dry canal. So try that out.
Okay, ma'am. And ma'am, can we use CHX in normal cases also, or it can only use in apical cases?
You can use, but I stopped using many years back because I realized that it has no benefit, because CHX, that is chlorohexidine, it needs time. Its action starts from 2 days and goes up to 12 weeks. Now the thing is that if I'm doing a single sitting root canal treatment and I do not give time only to my tooth, for chlorohexidine to act over there, then I'm wasting my money on chlorohexidine. I'm wasting my time on chlorohexidine. So that is why I recommended that in cases of chronic infection, it makes more sense to use chlorohexidine, while in cases of your routine cases, all I need is sodium hypochlorite and EDTA. Sodium hypochlorite for organic debris disinfection, and EDTA for inorganic part of the debris. This is what I personally follow. You can use chlorohexidine in each and every case also. It is a potent disinfectant. The only problem with it is that it requires more time for its action to happen.
Okay, ma'am.
All right, Dr. Sudhir, if there are more questions, what we could do is we could put it on the WhatsApp group also later, and I would find time and reply to them.
Yeah, already 20 minutes extra you have given. Time
Yeah,
was 3 to 3:30 p.m. So
yeah.
thank you everyone for listening patiently and cooperating for the audio. Thanks a lot. See you all and have a nice Sunday. Thank you, ma'am. Thanks a lot.
Thank you so much. Thank you. Have a good day.
Thank you, ma'am.
Thank you so much, ma'am, for the great lectures.
Thank you. Bye bye.